If you've been given an exercise program like this to resolve your piriformis pain, back pain, buttock pain, and/or sciatica problem, then please stop. This is a completely outdated, ancient, and totally unscientific way of solving your problem, and in this video I want to share with you why. Hey everyone, this is Dr. Charlie Johnson, physical therapist, and I help people all around the world with unresolved back, butt, and sciatica pains learn to fix themselves naturally using the power of the mind and movement as medicine. Now notice I said the power of the mind and movement as medicine. So if you were a scientist, right, and you were trying to find the cure for a disease, would you just give, say, 3, 4, or 5 different pills to someone in the study at once? No, you wouldn't. It wouldn't make any sense, right? Of course not, because you would have confusion about what worked or what didn't work. So why would you do this when trying to use movement as medicine? So in this video, I want to take a few moments to talk about why exercise programs for piriformis syndrome and sciatica, as well as just other back and butt and leg problems, only leave you confused and unclear as to what's actually working or not working. And so I want to share with you what to do instead and give you some tips so you can move forward with as much clarity as possible. So reason number one that exercise programs for these issues is a bad idea, and again I would recommend that you stop them and sort of follow this process, is because that there's too many cooks in the kitchen, right? So if you're doing more than one exercise at any given point, then you will never know what's working or what's not working. It'll all be based off of speculation. So what happens is people come to me and they say, Dr. Charlie, I've done all this stuff. I've done your exercises or whatever. And I say, no, you've done everything, which means you haven't done any one thing. And therefore, you may have done something that could have helped you, but I don't know because you mixed too many variables, all right? So if you've tried lots of things and you've failed to get relief, then it's probably because you're doing too many things at one time and you have no clarity about the impact of these individual exercises or motions or variables on your problem. And back to this idea of like movement as medicine. If you're taking multiple pills at once, then you might be offsetting the positive effect of one of the pills or one of the variables or one of the exercises in this case with another, right? So there could be some interaction there between the things you're doing, right? So you might be, for example, stretching your buttock, but then what if that is helping you, but then at the same time you're strengthening it? So you're lengthening and shortening at the same time. Imagine trying to loosen a screw. You've got your screwdriver, right? And you're trying to turn it to the right and to the left at the same time. The net effect is that you're not getting anywhere. It's just neutral, right? So that's what happens when you start mixing a bunch of different exercises together and when you start testing competing hypotheses at one time. So for example, if someone has given you an exercise program and you are doing certain, say, stretches, but then you're doing certain strengthening exercises to that same muscle group, then the person is just confused, whoever has prescribed that to you. They either have no idea what the heck they're doing and or they're just taking a shotgun approach, hoping that if they throw a bunch of stuff at the wall, it will stick. So what do I mean by this? Well, again, if you're stretching something, then the hypothesis is that that thing is probably too tight and it needs to be lengthened or stretched out. But then in the same program or the same set of 5 exercises on the same page, why are you then trying to shorten it or contract it or bring it close together, strengthen it? In that case, the hypothesis would be that it's weak. So you can see that you're testing one hypothesis of it's tight and it needs to be stretched out, and then in the same sentence, on the same page, you're saying, no, wait, maybe that's not right. Maybe it's not too tight and maybe it's too long or weak or something like that. So you can see the confusion. So again, you could be doing something potentially that helps you. Maybe something on your sheet of exercises is working, but because you're doing 5 other things, it might prevent that thing from working. And so the more you do, generally the more confused you will feel. And so if you do less, then you can often get more clarity and get better faster. And so when you think of movement as medicine, once you find the motion that works, then we can optimize the prescription, the movement prescription. And any given prescription has a dose, a frequency, so a dose is how much you take, a frequency is how often you take it, and then timing, when you take it. Maybe you take it with milk or something like that. Now, I'm not suggesting you do that with your exercises, but you get the idea. So you can say, okay, so we've isolated what works, and now we can kind of optimize how much we do this, how many reps or how long we hold it, how often we do this throughout the day, and then when we do it for maximal sort of therapeutic effect or benefit. So that's how you want to start to think about using movement as medicine. Again, if you were sick, you wouldn't just throw 100 different drugs at it expecting to know what worked. Instead, you would do as little as possible, as systematically as possible, and that is the only way to remain scientific. The second reason that exercise programs for these issues is just outdated is because of this analogy of you cannot exercise the bad diet. So hands down, the number one question I get from people in pain is like, Dr. Charlie, what exercise can I do to relieve XYZ problem? And the truth is that you can do all the exercises you want, but if your environment, physically or mentally, that which created the problem in the first place, is not conducive to you getting better, that won't do anything. Right? So if you're trying to lose weight, you can run on the treadmill all you want. But if you eat donuts for breakfast, lunch, and dinner, it ain't going to work. You can do all the stretches, shots, sheets of exercises that you want. But if, again, physically or mentally, you continue to perpetuate the problem or pick the scab, it just won't be effective. And so before you exercise, you want to fix your environment first and exercise second. Before you exercise, you want to do some detective work around the habits, the routines, and try to discover and become aware of what is perpetuating your problem with the way you're moving your body. Also mentally, if you have certain fears, concerns, worries, beliefs that you're holding on to, then realize that if you can't figure out how to neutralize these feelings and responses or emotions, then they can keep you from getting better. The third reason why exercise programs are not highly effective for these issues is because they indoctrinate people into this belief that, hey, if I have this problem A, then I need to do B. And the truth is it's completely false, and it doesn't make any logical sense. So if you're watching this video, maybe you've been searching for Piriformis Syndrome exercises, but there is no way that you can only exercise the piriformis. So what I mean by this is that if you have a certain problem and you want surgery and or injections or something that is very specific in the way that it's performed. For example, you could have a disc problem and they could go in and clip out part of the disc. But if you're trying to use motion to solve the problem, motion is inherently non-specific, and therefore there does not exist a specific exercise program for a piriformis problem or a disc problem. How can I say that? I think it makes sense, right? So if I said to you, hey, right now you're watching this, you think you have Piriformis Syndrome, or maybe you have SI joint problem, or maybe you're not sure. By the way, if you're not sure, you can click here. You can download my DIY diagnostic guide where I walk you through my flowchart to help you figure out what's going on. Either way, let's just say you have an SI joint problem, just for the sake of the example. Call it whatever you want. Go ahead, you as the person watching this in pain, just do an exercise that moves only your SI joint, or that moves only your piriformis, or that moves only the disc at the L4, L5 level. It's impossible. You can't do it. Probably makes you laugh. You'd be like standing there trying to awkwardly squeeze your butt cheeks and move around, realizing that it's impossible to just move that thing. All right? So what that proves is that, when you're doing specific exercises for what you think to be a specific problem, there's nothing specific about it. So if you're doing a press-up or cobras or following the McKenzie method for back pain, well, guess what? You're moving your belly button and your shoulders and your back and your nerves and all the joints and all the discs in your back and your hip flexors. You're doing all of it at one time. So that's kind of the blessing and the curse of motion, is that maybe you can't be very specific with it, but it also allows us to, get away from needing a really clear-cut, hard, 100% clear diagnosis. All right, so again, exercise programs that people look up and use for Piriformis Syndrome indoctrinate people into this belief that you need to really know what the heck is going on with 100% certainty before you can make any moves, because you wouldn't want to screw it up and do the wrong exercises for the wrong diagnosis. It's just not true. Reason number 4 that exercise programs are highly ineffective is because they indoctrinate people deeper into the belief that if they just do more or work harder or put in a couple extra reps or do it 5 times a day instead of 4 times a day and do whatever it takes, then their problem will be solved. But at the end of the day, right, this fuels the good student mentality. And I've never created a video on this, but just recognize that if you have that I'll do whatever it takes, good student, type A personality, then the chance of you getting stuck in pain is actually higher, because that personality is one that is driven by anxiety and continuing to just figure it out and grapple with your issues. So most people with those types of personalities, they work really, really hard to solve their problem. The harder they work, the more frustrated they become. The more frustrated they become, it just ends up being another treatment that doesn't work, and then they crash. So they ride this hope and despair or hope and discouragement cycle. And so Oftentimes, good students who will do whatever it takes, and exercise is very easy to, because you can move your own body, is very easy to overdo and to just think that if you do a little bit more, you should get there faster. But at the end of the day, what happens is it fuels the anxiety, the worry, the concern, and the trying to figure it outness, if you will, of the problem. And again, this can fuel pain psychologically because you give it so much attention and you give it so much meaning that, again, it backfires on you. And it places you in an even higher alert state than you already are as someone who's in pain. So at the end of the day, here's my recommendation. Do less. Move as much as you can. Find comfort. Focus on what moves well in your body instead of focusing on my butt cheek hurts and I'm trying to pull on this thing and stretch this thing and it's just not working. What other areas of your body do move well? What are the things in your life allow you to move your body and bring you joy? Because let's be honest, I mean, this stuff is no fun, right? So you want to make it meaningful to you at the end of the day. So you want to use good, safe motions to fix what feels bad. And here's the thing, there's lots of options. And yes, there is a process for helping you figure out what you should do and you shouldn't do. There's actually 8 steps to the process. But that being said, just start with something that feels safe. If you move when you hurt, this becomes a problem because life is motion. And if motion is painful, then what happens when you start to move and you hurt and you start to link movement equals pain, then it boxes your life in and you just live less and less life. And so you need to start training your body and your brain that it is safe to move. Oftentimes you don't need to fix a specific structure in your body. You just need to start breaking this when I move it hurts relationship. And you need to do that slowly over time in a very systematic fashion to double down on what works. So hopefully this was helpful. Let me know your comments below. Again, stay focused, stay scientific, and stay systematic. Otherwise, you're just trying a bunch of random stuff. Random inputs, whole sheet of exercise equals random outputs. And you really want to, if you're going to go through the trouble of doing this stuff and paying for it and spending the time and energy on these exercise programs, wherever you may be or whoever you might be working with, at the very end of the day, you at least want to know what worked and what didn't work, and that can lead you closer to the truth. So let me know in the comments below what you thought. Please be sure to hit the subscribe button as well as the bell for notifications when I go live every single week. Give it a thumbs up. Thanks.